Hafaday and welcome to the Guam Congress Building. Today's Monday, October 7, 2024. The time is 3:40 p.m. This is the Committee on Health, Land, Justice, and Culture. I'm Speaker Therese Terlaje. I'm the chairperson of this committee. I'm joined today by the Vice Chairperson, Senator Brown, by Senator Taitagui, Senator Chris Barnett, our Minority Leader, Senator Frank Blas, and I believe Senator Dwayne St. Nicholas. In compliance with the open government law, notice for this public hearing was published in the Guam Daily Post and posted to the Government of Guam Public Notice Portal on Monday, September 30 and Friday, September 5th, 2024. Notice was also sent by email to all senators and all main media broadcasting outlets. This hearing is being live streamed on the legislature's YouTube channel. I ask that all who are testifying please state your name and what association you represent before you testify. This hearing will be transcribed. This is an oversight hearing of the Guam Memorial Hospital Authority, and I sent them in advance a list of items to include in this oversight would be billing and collections, threatened services due to budget constraints, status of non-emergency surgeries, hiring freeze status, maternal child care project, hospital facilities, and the public-private partnership. I want to thank all of you who are here. I see all the hospital management team led by CEO Lillian Posadas. I also want to recognize one of the Board of Trustees members, Dr. Borja Sizos Masi. And sorry.
Edgar Aguilar.
Edgar Aguilar, another Board of Trustees member. Sizos Masi, Mr. Aguilar. All right, so this is following a oversight hearing that we've had on January 16, 2024, where the management team presented updates on billing and collections at the start of FY24, showing that average monthly collections increased approximately 10.2 million. And then during the budget hearings in April 2024, GMH reported billing 31.9 million and collecting about 31% of that amount, or about 10,056,000. The committee now seeks updated information to evaluate whether billing and collection efforts have improved and to understand how these collections will impact GMH's FY 2025 operations. Not announced at that time was a forgiveness program or amnesty program for overdue accounts, or what the goals or impacts of that program would be, then we will talk about that today, hopefully. At the budget hearing in May 2024, GMH presented their request of 74.3 million through their acting administrator, Dr. Prince, at that time. That 74.3 for operations for FY25. In FY24, GMH received 30.2 million. So this request was about 44.1 million more than their appropriation in FY24. In the FY25 budget that has just passed, GMH received 37.7 million. Again, in contrast to the 74.3 million that they requested. And the governor's request for GMH prior to the budget hearing was 31.8 million for FY25. That's 1.6 million from the FY24 budget. During the budget hearing, GMH outlined 3 potential scenarios depending on the amount of funding, and said that the governor, Ms. Lillian, and GMH executive team and the Board of Trustees were aligned with this proposal. And the 3 options were: 1, maintain the current operations, and they needed a fixed appropriation of 60 to 80 million each fiscal year until the new hospital is built. Option 2, cut services. If GMH receives a $30 million subsidy, this would cut some of the secondary units, which would allegedly save 20 to 30 million a year. Secondary tenants of GMH included ICU and telemetry wards, pulmonology, gastroenterology, interventional radiology, podiatry, interventional cardiology, telemedicine services, and neurosurgical. And option 3 that they presented at that time was cut and close all the secondary tenants if the subsidy for GMH is less than 10 million. So again, the appropriation for GMH so far for FY25 is 37.7 million. Right after the budget bill, we introduced a bill to appropriate an additional 20 million from FY24 excess revenues to GMH for FY25 operations. The governor, in an interview in September 24, 2024, asked that all available surplus funds be directed to GMH, despite signing the budget bill as it was. And recently, in a hearing in support of the supplemental bill, GMH testified that the governor is advocating an additional 20 million and that they would be able to operate with an additional 20 million. The media, and now I'm talking about the status of non-emergency surgeries. The media reported September 30, 2024, that non-emergency surgeries were at risk of suspension due to shortage of critical supplies. Specifically, hospital is in need of circuits for anesthesia machines, with only 12 remaining in stock. Shortages of other essential items such as sponges, linens, towels, and face cloths were also reported. And again, on the hearing on the supplemental budget bill, the CEO testified that the governor advanced $5 million in their FY25, but from their FY25 appropriation, and they were able to pay off some vendors and get more supplies. So hopefully we just get an update on that today, on the non-emergency surgeries and critical supplies. Again, it was reported in PDN about a hiring freeze, and while it's not yet in effect, it poses significant risk, especially we want to know if it's going to affect the shortage of nurses and the retirement of the pathologists, where we have vacancies, that type of thing. The maternal child care project, this again is an update at the last informational briefing on May 10. They talked about this project, which dates back about 10 years, that they were moving forward with it. And other hospital facilities, of course, were slated in the previous hearings in May to be funded through ARP funds, and we're going to get an update on those. We also asked GMH to talk about this public-private partnership. This was a law mandated in 2016 after a task force report recommended to pursue public-private partnership as a model to ensure sustainable and quality facility for the people of Guam. Public Law 33-143 mandated GIDA to publish an RFI, request for information, to solicit public interests and the desired direction public policymakers wanted to go in that RFI. 3 companies responded. There was a bill back in the 35th legislature to require GMH to prepare an RFP following that RFI. That has not been done. The bill did not pass at that time either. There were 4 concerns by GMH at the time. They said they were not entirely opposed to the concept of the bill, but they had challenges such as the Board of Trustees does not write the RFP, executive management does. The RFP does not go to the Board of Trustees. I guess that's what was being proposed in the bill. It goes through the procurement process. Funds need to be identified for this public-private partnership. AG needs to be involved, and contacting professional company takes time. So we just want to see if there's any been more movement on that. All right, so we'll begin with billings and collections. I'm sorry, maybe Ms. Lillian, Ms. Posadas, if you could tell us how you want to proceed. I see you have a PowerPoint versus, yeah, please.
Yes, good evening, Speaker Terlaje and Senators. Buenas, Guahusia, Lillian Perez Posadas. I am the hospital administrator. On behalf of the Board of Trustees, management, medical staff, employees, and the patients we service, we extend our appreciation for giving us the opportunity to engage in this legislative leadership in a healthy and meaningful dialogue, as well as update you all, particularly with our dire financial predicament. As the hospital administrator, I, as well as all our respective leaders of our Executive Management Council, we are extremely concerned, but despite these concerns and issues, we continue with a steadfast resilience to carry out our duties and responsibilities to keep our one and only public hospital operational as premised on our new mission statement, which was just approved by the Board of Trustees on September 24, 2024. And that mission statement is committed to compassionate, forward-thinking, quality-driven, and safe healthcare that honors the community. This is the mission we continue to embody, and yes, we accept the community's critiques to hold our GMHA leadership accountable and responsible, because it is our ultimate vision to be Guam's trusted hospital. With me this afternoon are members of our Executive Leadership and Management Council, we call the EMC. To my right, we have legal representation, Jordan Pauloon. To my left, we have Ms. Yuka Hechanova, who is our CFO. To her left is Dr. Niami, our acting Chief Medical Officer, also called the Associate Administrator of Medical Services. He is a neurosurgeon, one of the few on island, so we are very blessed to have him at our hospital. To his left is Ms. Rodalyn Gerardo. She is our Deputy Assistant for Operations. And to her left is Mr. Zaudi, we call him Zaudi Togadi. He is our Associate Administrator of Operations. In the background, we also have Mr. Tony Ogden. He's our HR Administrator. We have Christine Tucaro, Nursing Administrator, and Lizelle Conception. She is the Deputy Nursing Administrator, and Ms. Bell Rada, who is the Associate Administrator of Professional Services. So if I may begin.
All right, if we could take 1 minute.
Sure.
Where's our Sergeant Roberts? He's going to swear everyone in very quickly.
Oh, okay.
If you can please stand and raise your right hand.
Anyone in the back is going to be testifying potentially. Please be sworn in as well.
Under penalty of perjury, do you all affirm that any and all information you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth? Madam Chair, you're under oath. You may proceed.
Sejus Masi. Lillian, Ms. Posadas, could you please, spell doctor's name?
Dr. Virat, V as in Vavoom, E-R-R-A-D as in daughter, and we call him Kwasi, K-W-A-S-I.
Thank you. Please proceed.
Thank you. If we can begin with our PowerPoint presentation. I think you have copies of it, but we also want to just share it for the people out there in virtual. Okay, we can start with slide number 2. I wanted to just set the foundation here with the historical foundation that, back in 2016, the legislature did a research. And what they found was that, prior to 1956, free health care and hospital services were provided by the U.S. government. After 1956, the original Guam Memorial Hospital was constructed at the Sutpon Point. Therefore, free health care and hospital services continued. That's the mindset of the people back then, and it continues to be the mindset to this day. In the 1970s, because of this free healthcare and hospital services, the hospital's deficit was $9 million. In 2015, the deficit increased to $15 million. By the time I came on board in 2019, the deficit reached about $30 million. Thus, why we needed to continue requesting for appropriation from this legislative authority for $30 million. You mentioned, Speaker Terlaje, that in fiscal year 24, we requested a budget of $30 million, but then we came back again before you and asked for supplemental special appropriation, another $30 million to then help us pay those vendors. So really, in fiscal year 24, we needed $60 million in order to keep our operations going. Thus, since the acquisition and commencement of hospital services by the local government, the practice of the government is to provide funding to sustain the hospital's mandate to provide care and treatment regardless of their ability to pay. Our mandate. Next slide, please. To kind of show you all the full picture of the hospital services that we provide and the various entities, various departments, and the various units that we need to keep the hospital, all the services that we provide, inpatient, outpatient, emergency room, the medical, the nursing, the professional support, including some outpatient services, as well as the non-clinical side, to help us, like housekeeping. They need to clean the room, they need to empty the trash, because we can't depend on the nurses to do that while taking care of the patients. We need the security guards, we need the billers and the coders, and I'll have Yuka talk more about that in terms of our billings and our collections. But this is really the full gamut of the hospital organization. Thus, we need that $74.3 million to keep it operational for fiscal year 25. Next slide, please. To follow, to be in line with your agenda, Speaker, we've got, we'll cover the fiscal updates in terms of billings and collections, the accounts receivable, accounts payable, in terms of the hospital structure itself, the facility, all the CIPs. And so Rodel and Zaudi will be the ones to present and talk more about that, and our IT updates. The recently completed CIPs, ongoing and upcoming CIPs, including the maternal child health project, the electronic health record, and the $20 million ARPA funding commitment that the governor has given us in terms of some of the CIPs that we need to get done. And you mentioned threatened services due to budget constraints, the clinical services, patient care, the electronic health record that impacts that, elective surgeries that we had mentioned and discussed before, that we were so close to suspending elective surgeries because of the supplies that we were running really low or even not in stock, onboarding of new doctors, pharmacy services and pharmaceutical supplies, and that's because of the vendors that we owe and they put us on credit hold, laboratory services and supplies, and surgical supplies. So these are all that we will cover in our presentation. I know you mentioned in your agenda the public-private partnership, but I did not really expound on it further because we do not, the bill that former Senator Moynihan authored, Bill 305-35, for the Board of Trustees to engage in an RFP, again, because the Board of Trustees, their governing body, are not the ones who really push out RFPs. It's us in management. So unfortunately, that bill did not go forward, but certainly we can revisit that if that is what's going to help the hospital. And now I will hand it over, next slide, to Yuka, who will talk more about the billings.
Next slide, please. Okay, thank you. So for billings, there's a comparison here between FY23 and FY24. In FY24, we made a considerable improvement of 42% over FY23 in the number of claims that have gone out. There are a number of reasons for this. In FY23, if you recall, we were recovering from the network shutdown and also from Typhoon Mawar. Those were two big events during that year that impacted our billings tremendously. In FY24, we also hired a business office manager. We hired Medicare billers. We increased room and board rates in November of 2023. Right now, our coding is current, and there are coding claims right now that are 30 days and under. So our productivity has gone up. We've done many things to improve it, and we are continuing on that path. It started in August 2023, as you can see from the graph, where we started catching up with billing, becoming very aggressive with our billing, actually investing in like overtime and things for the billers to get caught up. We were able to get around a lot of the issues we had with the network shutdown. The billers came up with some workarounds, and we were able to sustain the billing. Right now, we're billing an average of about $27 million a month compared to $19 million the month before. Next slide, please. For collections, this year we're averaging 9.9 million compared to 9 million in FY 2023. This is an increase of about 11 million for the year compared to FY 2023. This is actually net of the Medicaid advances that we received back in FY 2023 to help us with cash flow and deal with all of the issues we had back in 2023 to pay our vendors to make payroll. We were able to leverage our Medicaid receivables and receive about $22 million in Medicaid advances. In FY 24, we began paying those advances back. So to date, in this month, we will have paid down the entire amount. So this, if you look at the numbers above, you would see that the Medicaid collections have gone down dramatically, and that's because DOA has been clawing back or recouping those amounts that we have been paying. So had we received the full Medicaid reimbursements from the claims, we would have actually netted about $38 to $40 million in Medicaid payments. So now that this receivable of DOAs is now paid off, we foresee it carrying on in FY 2025, where we will receive a significant amount for Medicaid and be able to sustain about $11 million a month in Medicaid and in full collections, which meets our budget projections. On our self-pay, we have done some things this year. We signed an MOU with Public Health to help our eligibility specialists actually process Medicaid claims for the patients. So the thing we were trying to do is aggressively turn self-pay patients into Medicaid patients so we can collect on that. This month we started a self-pay amnesty program that will run till the end of the year, where we have, we're offering a 50% discount to those with self-pay accounts, that if they come in, they'll get a 50% reduction on the balances that they owe. This is to help the cash flow and also to improve our receivables. In the next quarter of the fiscal...
You could just clarify, that's only for those who are self-pay. So if you have any kind of insurance, you do not qualify for any type of discount?
No, it's for true self-pay patients.
All right, thank you.
In the second quarter, we want to start a sliding scale program where those that do not have insurance and do not qualify for Medicaid can apply for a discount based on their income. Similarly to Medicaid, where they will supply documentation showing what they make, what their income is, what their assets are, and then we'll compare this to what the federal poverty level is, and if they're at 200% of the federal poverty level, they will get a discount. And the discount will range from between 20%, 50%, all the way to 100%, depending on their income, but with at least a minimum payment of possibly $100. We're just kind of, we set this for the second quarter because we're still ironing out the process and the procedures. This is actually spelled out in the National Healthcare Service Corps guidelines, and so we're not inventing this from scratch. It's really already a process that's been happening in other hospitals that participate in this program, and so we're looking at their guidelines and adopting them to how it fits our hospital. In the third quarter, we want to engage the collection agency to hand over the accounts that did not get paid off through the amnesty program, and possibly they don't qualify for sliding scale. We're trying to do as much as we can to get patients the ability to pay their accounts as much as they can, and also to get a good handle on our receivables before we finally start utilizing a collection agency as really the last resort to collect on these accounts. Also, I wanted to point out some of the dips or the spikes in the collections graph. So beginning in April of 2023, that's when we received our $10 million Medicaid advance. That was the first payment we got from the Medicaid advance. The second one was in May for $3 million, and these are the periods immediately following the shutdown when we really had no cash coming in. In June, we received 1.3, and then in August, we received 6 million, which is the other spike. And the final $2 million came in October. That makes up the spikes on the graph, because it really looks unusual. Next slide, please. So these are the receivables. These are net receivables, not gross. This is what we expect to collect based on the arrangement, of course, we have with Medicare. We've been testifying earlier that we are on a TEFRA hospital, so we get paid on a per diem basis. This is really what we expect to collect. So even for third-party payers, we don't get 100% of what we bill. There are things that come back as non-covered benefits or denials, and so we account for that. Roughly 10 to 20% of the claims that go out to the third-party payers we consider not collectible. In total, what we expect to collect is $42 million in receivables. However, we do have a number of social cases that we've also discussed with the legislature. They stay in the hospital, they can't be discharged. A lot of these social cases are right now under Medicaid or Medicare, but Medicaid and Medicare will not cover indefinitely. So there will come a time where their benefits will run out, and then it will drop to self-pay. And so I wanted to just show that of the receivables that we have, a significant portion of that is actually attributed to the social cases. Next slide, please. For vendor payables, right now, our payables to vendors are about $14.6 million. We mentioned earlier, we did get a $5 million advance for the pharmaceutical fund for FY25, and that went towards paying down that $7.1 million that we owed for supplies and pharmaceuticals. So as of today, they are all paid off. So I'm expecting the supplies to start rolling in today. However, this is an unaudited number. We just finished 9/30, the end of the fiscal year, and all invoices have not been received yet. So this number is actually expected to grow. But the accounts payable is much better than a year ago. 1 year ago, we came to you and the legislature gave us the $30 million, which helped us a lot to get caught up with the vendors at that time. But as you can see, the payables is still considerably high at 14.6, almost $15 million. We do place our cash priorities on payroll, including our doctors, our contract doctors, and on clinical supplies and our EHR payment. Yeah, and payroll payables. Next slide, please. This just shows the FY25 budget and how we have met together as an executive committee to really decide what we wanted to cut. We realized that we did not get the full appropriation that we asked for, and where could we really cut? We were able to cut $5.6 million from personnel. This about $1 million to $1.5 million was actually due to the reduction in the retirement contribution rate, which was initially around 33%, and now it's down to about 30%. And we also reduced personnel by not fully funding vacancies. What we've done in the past is fully fund vacancies, so we always have that opportunity to hire people that come in. We need to hire them right away. We don't want to have vacancies unfunded. But because we are cash strapped right now, we partially funded the vacancies and were able to cut our personnel by about $5.6 million. We cut another $6.6 million because of the discussions we've been having on having to wean ourselves off of travel nurses. And so if we can get rid of the travel nurses, we will save about $6.6 million. The 6.6 also includes some amounts for administrative supplies. We didn't cut anything for the clinical supplies because those costs just keep rising all the time. And then, of course, we received additional appropriations in the FY25 Budget Act of about $5.9 million. So the impact of everything is it reduces our shortfall to $24 million now from the 42.5. Next slide, please.
Just clarify, what is FY25 budget submitted. What does that column mean?
That was the original budget that was submitted to the legislature,
Your request
the request, yes.
for 247 million? Wasn't it 230? Your request was, you're saying your
With-
request was 232?
That was our budget, our operating expenses, the budget for the operating expenses, but we requested 74.3 million.
74.3.
Yeah,
So how do we read this thing?
I'm sorry?
It's not broken down where the 74.3 goes in your overall budget.
No, because it
Okay.
already included the amount from the pharmaceutical fund of 23.3, and then 8.5 from the general fund, from the governor's executive budget. So our overall shortfall was 42.5. Now it's down to 24.4.
Based on the appropriation that you received. Okay.
Yes, from the increase
All right,
in the
please
new act. So Rodalyn will speak next on the updates on the CIPs.
Good afternoon, everyone. My name is Rodalyn Gerardo, Deputy Assistant Administrator of Operations at the Guam Memorial Hospital Authority. Mr. Rizaldi Tugati, Associate Administrator of Operations, and I will be presenting the status of GMHA's hospital facilities and capital improvement projects. It is no secret that the Guam Memorial Hospital is an aging facility. While our facilities maintenance crew do their best to maintain our hospital, many of our infrastructure and utilities have reached, or in many cases are already beyond their useful lives. The COVID-19 pandemic and the economic factors such as limited supply of skilled workers on Guam have resulted in the continual increase in construction, labor, materials, and equipment costs. These factors, combined with GMHA's ongoing financial challenges and inability to timely pay our vendors, translate to more costly repairs and equipment costs. While we are looking forward to a new hospital, our team remains committed to maintaining and keeping our only public hospital operational. We are excited to share these next few slides with you, which have been divvied up into 4 main categories, as you can see. Heat, ventilation, and air conditioning, also known as HVAC upgrades and other utility projects, structural and architectural projects, medical and other equipment, and IT network and system infrastructure projects. This first slide provides a list of our CIP projects that were completed during calendar year 24. These projects and equipment were paid for with local and federal funds, specifically general funds, the audited surplus funds as a result of the fiscal year 22 audit to support specialty physicians, the Department of Interior grant funds, hospital preparedness program funds, and the $22 million American Recovery Plan Act, or ARPA, funds from Governor Lou Leon Guerrero.
Where are you reading from? Where is that list?
Still on this slide.
Where's that list then? Which
Page,
list?
10. It's the completed CIP.
Where you mentioned where the money was all coming from, that section, because on page 10, you have capital improvement projects, but I'm trying to
Yes.
see where the funding that you were talking about that you received.
Oh, I was going to go into the details of
You don't have it written down for us to see?
not there, but I can provide that to you.
Can you read it again, what you were talking about, where the funding was coming from again?
Okay.
Right.
I said the first slide provides a list of our CIP projects that were completed during calendar year 24. These projects and equipment were paid for with local and federal funds, specifically the general fund, and I was referring to the audited fiscal year 22 surplus funds that was from Public Law 36-107, and that is for the specialty physicians. because in order to hire the specialty physicians, right, we had to also procure equipment for these physicians. And then as well as some of the funding came from the Department of Interior grant funds, and then hospital preparedness program grant funds. How much? I don't have a breakdown of all of those. I kind of have it by project. So I was going to go through that. And then, of course, the $20 million ARPA. Okay. So proceeding on to the HVAC projects that were completed in calendar year 24. So as we know, the HVAC system assists the hospital in maintaining the environment of care and addressing our mold mitigation plan of corrective action. So in calendar year 24, we completed the power source installation in the OB and labor and delivery wards in June 2024. This is what was, this powered the split air conditioning units in the OB and labor delivery ward and have attributed to lowering the temperatures. So as you recall, earlier in the year, there were some challenges and complaints in that the temperature in those wards were really high and not suitable for our delivering mothers and their babies. And so we've addressed that project. And then we've also procured 15 standalone dehumidifiers, which were strategically placed in certain areas throughout the hospital, as well as in the skilled nursing facility. But our facilities and maintenance staff continue to monitor the humidity levels, and we relocate those dehumidifiers as needed. We continue to coordinate with the Guam Power Authority to conduct quarterly preventive maintenance on our main electrical distribution and sub-panels. And the quarterly PMs were done in March, July, and September, with the fourth quarter preventive maintenance scheduled for December 2024. Our 3 generators within the hospital, which is one 650 kilowatt and 2 1.6 megawatt generators, also received preventive maintenance in March and April 2024, while the generators at our skilled nursing facility were also received their preventive maintenance in July 2024. The hospital has also procured 34 portable air conditioning units that have been deployed throughout the hospital and the skilled nursing facility to also address warm pockets and maintain our environment of care. There are also 36 split units with high-efficiency particulate air, or HEPA, filters that have been installed in the OB and L&D wards, intensive care unit, emergency department, specialty services, pharmacy, and other areas throughout the hospital. Moving on to structural and architectural projects. GMHA's liquid oxygen enclosure tank expansion project was completed in March 2024 and was paid for with ARPA funds. We recently recertified the Z-Wing demolition plans, and we worked with the Community Defense Liaison Office of the Governor to submit an application with the Innovative Readiness Training, or IRT, of the Department of Defense. The IRT provides joint training opportunities for military personnel, and the training services are focused on healthcare, construction, transportation, and cybersecurity. What we hope to gain with submitting that application is to be able to demolish the remaining second floor of the Z-Wing in hopes that we would not have to pay for the labor costs. So we're trying to partner up with the military for that project. Regarding our envelope typhoon mitigation, the hospital envelope typhoon mitigation, due to the hospital's aging facility, approximately $3 million in ARPA funds have been allocated for wall hardening, window and shutter replacements, window sills, etc. We currently have 2 active solicitations for this project, and we're hoping that we would have the submissions are due for these projects by the end of the month. It is important to note that the MCH, which is the Maternal Child Healthcare Renovation and Expansion Project, will address part of the hospital's envelope concerns, particularly when the front courtyard is converted into the neonatal ICU, or NICU. The power source provisioning for the SNF alternate care site container was also completed in September 2024. And then we also completed the removal of the temporary flexible hose and piping at the SNF to address our SNF redundancy pump, or to prepare for our SNF redundancy pump. And that was completed in April 2024. Regarding our, moving on to our medical and other equipment. So the contract for the angiography machine and hemodynamics recording system, or also known as our Angio Suite, was awarded in November 2023 with a cost of $1.5 million and funded by the Department of Interior. GMHA officially launched this state-of-the-art machine, the first of its kind in our region, on September 18, 2024. The Angio Suite is equipped with advanced imaging and surgical equipment for angiographic procedures such as stroke diagnosis and targeted interventions and treatments, which then translate to quicker recovery times, reduced complications, and improved patient outcomes. During the installation of the Angio Suite, it was also determined that GMHA needed to procure an Active Directory server, which we did procure at a cost of $17,560 of ARPA funds. This new server arrived in August 2024 and was successfully installed prior to the Angio Suite's go live. In February 2024, our CT scanner in CT Room 1 went down, requiring the X-ray tube to be replaced. The replacement X-ray tube was purchased using ARPA funds and was successfully installed in March 2024. We also received, with our ARPA funds, the portable hearing diagnostic and screening instruments. These arrived in August 2024. To support our maternal child health care and NICU, GMHA procured a jaundice transcutaneous bilirubin meter, as well as neopuffs, which are the infant resuscitators, and neonatal vein scopes using the Hospital Preparedness Program funds totaling $18,000. To support our specialty physicians, approximately $2.3 million was used from the audited fiscal year 2022 surplus funds to purchase specialty medical and surgical equipment, such as the echocardiogram machine, arthroscopy machine system, endoscopes, implant system, a power table, transducer, bronchoscopes, spirometer, and colonoscope. The anesthesia and fluoroscopy machines are still under active procurement at this time. Moving on to our IT network and system infrastructure. GMHA procured 175 tiny form factor desktop computers, which arrived in April 2024, and these are used to replace our problematic end computers hospital-wide. We also procured firewalls totaling $19,150 using ARPA funds. These firewalls arrived in September 2024, and this is needed as part of our corrective action plan from the 2023 IT shutdown. Also part of the 2023 IT network shutdown corrective action was to purchase and install various IT servers. We actually purchased a total of 16 servers, and which cost over $231,000 using ARPA funds. These servers have arrived as of September 30, 2024. In addition, we also successfully transferred from our SNF to GMH a total of 30 CCTV cameras that were needed to replace many of the inoperable CCTVs in our main facility. That project was completed in September 2024. There was a cost to that. I don't have it offhand, but I can get that information. It was ARPA funds, yes. And then Mr. Zaldi will now discuss our next slide.
Thank you. Good afternoon, Madam Chair and members. So, in continuation of Ms. Rodeline's completed projects, we now go to the... Thank you. Okay. In continuation with Ms. Rodeline's completed projects, we now go on with the ongoing and upcoming CIP projects. Actually, these are all the bulk of the projects, as these are the big ticket projects. Starting with the HVAC projects and utility improvement, we got 450-ton chillers and the 265-ton chillers, costing 2.3 for the 40-ton and about 1 million for the 265. These are all both from ARPA funds. We're continuing with our HU projects. We're putting in 40 in total to make up for the 63 new units if completed. These are also coming in from the 20 million ARPA funds, and we're looking at 2 million to spend for the 40 pieces of AHUs. We are also in active solicitation for each emergency department, AHUs, and DOAS. DOAS is the dedicated outside air system installation and commissioning project, which is funded by or through DOY. We're also continuing with the OR room, AHU, and exhaust fans upgrade. Again, also DI funded project, and it's an active solicitation. We have also SNF B-Wing isolation project, which is at 99% completed. We expect to complete this month, October 2024. Through our ARPA funds, we also look to replace and complete the SNF redundancy pump projects, as well as the SNF and GMH hot water tanks replacement. We are working with our A&E to certify the boiler plants, which we will begin the solicitation for the removal and replacement of these units. Again, these units were commissioned in 1989 and 1999. GMH also received a 2.7 grant award under
Funding
the...
source on the boiler? Funding source?
Oh, for the boiler? That's also ARPA. We also received a 2.7 million grant under the DCIP, Defense Community Infrastructure Program, to upgrade our HVAC system in our multi-purpose unit, which is formerly the urgent care. Accordingly, we are beginning the recertification process for the plans for this project. We also submitted 2 FEMA hazard mitigation projects, application via the Guam Office of Civil Defense, where we intend to replace one of our 1.6 megawatt generators, which is what we call the Old Faithful, acquired and commissioned in 1992, and one of our 650 kW generator as well. Going forward with the next category, the structural and architectural projects. As mentioned earlier, the MCH, Family Birth Center Renovation Expansion Project, we are in the process of recertifying the drawings and design, and hopefully we'll get it by end of this month. Then we'll push through with the procurement process and hopefully get that obligated before the end of the year. The MCH project, we're looking at 21.5 million, 16 million for the construction, and we need 5.5 million for the furnitures, fixtures, and equipment to complete that project. That, however, is not yet funded.
Where's that?
Come again?
Where is that on this chart?
The MCH, ma'am?
Wait, what is it?
It's under the structural and architectural projects category.
What are we talking about right now? What is,
This is the continuation of the CIP project. I'm now
yeah, no, the one you
reciting
just read.
MCH, Maternal Care Health.
Where is that here? Oh, you mean that number one, the bold is that, okay, all right.
Okay. Okay, next I have here is the roof and envelope projects.
I thought you talked about that one already.
Yes, ma'am, we did. Part of it is completed, but we still have to continue in with the rest.
Can you, yeah.
For this first, second, and third floor, the roof repair is still an upcoming project. And as it was mentioned earlier, for the first and second floor, that's part of the maternal child health renovation that will then enclose that, how do you call that, open courtyard. So that's going to be then roof repair and hardening for that section. Does that make
So
sense?
is that included in the MCH plans or
That's part
different?
of the MCH plan,
So
yes, ma'am.
this headline MCH includes all the bottom things? No?
No,
Yeah,
ma'am.
All right, just one is bolded, okay. So, all right,
Because the roof repair also has a third and fourth floor, which is separate from the maternal child health.
all right.
Okay,
This is very hard to follow. Last time you did it, you gave us ARP funds, these are the project, and then other funding sources, but please proceed.
Okay, thank you, madam. Next, I have the Center Island Parking Expansion Project. Everyone is aware that parking is a premium at the hospital. The Center Island Parking Expansion Project will generate at least additional 38 parking slots. This is active solicitation with bid submission anticipated by early 2024. Zewing Project. we
Funding
have
source.
ARPA.
Are these all ARP?
Majority of the projects are ARPA.
Okay, which one's not in this box?
So the MCH, part of the MCH is from the Public Law 36107, the $15 million. And then $1.6 million is ARPA. And then the rest of that, under the structural architectural improvement, are ARPA funds.
All right, thank you.
Okay, continuing with the Z-Wing project, we have completed package 1A, which is the demolition of the 67% of the existing structure. There's 3 more packages that we are working on. Package 1B, demolition of the remaining second floor. Package 2, renovation and conversion of the remaining first floor to business office. And package 3, conversion of the cleared space into a parking lot. This as well would generate at least additional 28 parking slots. This is in active solicitation with bid submissions due by end of November 24 or mid-October or earlier. Another ARPA-funded project to be solicited later this month is the Emergency Department triage, automatic sliding door, and window replacement. Moving on, medical and other equipment. We have automated medication dispensing system. This is what we call PIXIS. We are working on finalizing the procurement and contract for this system, which costs around $793,000 and will be funded by ARPA for the first year. We also have the picture archiving and communication system, radiology information system, in short, PACS-RIS. GMH is working on finalizing the procurement and contract for these packs, Riz.
Is this box all ARPA funded? I'm just looking to save some time. Are these all ARPA funded, and are these are all included in capital improvement, such as chairs replacement and things like that?
Yes, ma'am. We put that in there.
So the PAX risk is the funding source, I believe is the, it's ARPA also. There's another the echocardiogram machine that's on this section is actually to be donated by the GMHA VA, Volunteers Association. It's the third bullet.
Yeah, so those are labeled the GMHA VA
Yes.
equipment. The rest are ARPA?
Majority of them are ARPA, except for the fluoroscopy,
Okay.
the anesthesia machine. Those are the fiscal year 22 surplus funds, the physicians.
All right. Okay, thank you. I don't think you need to read this list. We're good, right, senators? Yeah, and if you could just move on, yeah.
Okay.
Next slide.
Okay, next slide. Turn it over to Rodlin.
Okay. I just wish to correct myself for the 30 CCTV units that were transferred from SNF to GMH. We used general funds for that, totaling $39,000, just to make that correction.
All right. And the ARP funds, when did you receive them?
October 2023.
Okay. And you intend to spend them by December 2024?
We intend to obligate by December
Obligate
2024,
only.
yes. Per the rules, we have until December 31, 2026 to spend.
2026 December?
Yes.
Okay. 2026 to spend. Okay, thank you. And you've outlined for us how much of the 20
Yes.
million?
So your next slide
Okay.
is the update for our ARPA. So after all of the projects that we mentioned, you'll see on the next slide. I'll just wait for that.
All 20 million is obligated, or projected?
Well, we're tracking.
Okay.
So, sorry. We are tracking a total of 47 projects, and we're happy to report that 8 of those projects have actually been completed, totaling $963,300. We also have 20 projects totaling $7.5 million that we either already issued purchase orders and are pending completion or receipt of the items, or we are about to issue purchase orders, meaning to say the procurement has pretty much been done. We're just now on the tail end. We also have 19 projects that are currently in active solicitation, or we're about to issue the solicitation. Altogether, we have drawn down a total of $942,115 as of October 2, 2024. Again, keeping in mind that we have until December 31, 2026 to spend or to draw down on these ARPA funds.
You said you had 19.
Yes.
Okay, 19
Active-
what? Because right now I'm showing drawn down is 11.
19 projects on active solicitation or about to be solicited.
Oh, plus 4,
Right.
okay.
So it's a 15 plus 4, yes.
Okay, thank you.
So pretty much this is our listing. We have been working diligently to track our ARPA funds. The $20 million that was given to us, we're trying our best to be, diligent and making sure that we're using the ARPA funds for projects that the hospital most needs. And so, again, as you can see, our team has been working really hard to obligate all of our funds, and barring any extenuating circumstances, we are actually confident that we're able to obligate all of these funds by the deadline of December 31, 2024. The actual listing of the ARPA, I know that we did provide in advance to Speaker Terlaje's office as per her request. So that was provided since Friday. Thank you.
Please proceed.
Okay, we can go to the next slide, slide number 13, where, we do have this mandate to provide care to all people of Guam, regardless of their ability to pay. However, the challenges that we are faced with, one of them is that, the first one, Guam's population of uninsured and underinsured results in a decrease in our ability to collect, to get payment. Second one is Guam's Medicare reimbursement rate is limited. This is where, again, because of, as CFO Yuka mentioned, the TEFRA reimbursement rate, we only get a per diem reimbursement. So you can be in the intensive care unit for $10,000 a day. Medicare will only reimburse the hospital $1,600. So that's where we lose funding, a reimbursement. Building is outdated, as it's been mentioned, and we all know that. And the upkeep and the fixing and the repairs, it really does cost us a lot, not only in labor, but also in equipment and supplies to repair and to fix these parts that break. We do have, and then there's the increase of healthcare supplies and providers, as Yuka mentioned earlier. Pharmaceuticals alone have gone up 20% since COVID, and so labor costs, doctors and nurses and health professionals, in order to really recruit them and retain them, we have to pay them something that is commensurable and competitive. We have 21 social cases at the hospital and SNF. These social cases who do not have any insurance at all, or that their Medicare, Medicaid will be running out, they become self-pay, the total cost in 1 year is $20 million in hospital bills. Some of these patients have been there for 4 years, 5 years, and so that builds up in terms of the costs that we're eating up at the hospital. Non-covered charges, such as those individuals who come into the hospital with diagnosis of drug-related conditions or even motor vehicle accidents, insurance, private insurance, do not cover those. Hospitalization do not cover those services, and so therefore, again, that's part of what we don't get reimbursed.
Sorry, can you just verify all vehicular accidents or only those involving drugs?
No, all vehicular accidents,
Not covered.
they're not covered
The
by...
vehicular accidents are not covered initially because there's a third party involved. So the insurance companies will bill the claim and then they'll deny it. And they'll want you to claim against the party at fault. And so that's where we get denials for these vehicular accidents as well.
Or the individual, the patient becomes self-pay. In terms of staff shortages, it really does affect our ability to keep the beds open. Right now, we have patients in the emergency room waiting to get a telemetry inpatient bed, and sometimes they wait 2 to 3 days. Although we are able to expand a little bit of our telemetry beds in the 3rd floor, medical surgical, we do have telemetry capacity now, and so we're getting the nurses trained to be telemetry nurses. But that's a slow process, but it does affect our ability to keep those beds open. Limited specialized healthcare workers on island, we have to, like it was mentioned earlier, the University of Guam, because of their nursing faculty shortage, they can only enroll 30 individuals annually. And if by luck that they'll all 30 graduate, they go through the program and they graduate, we don't always get all 30. We probably get half of it. Most of them go off island. So not only nursing, are we limited, do we have a limited pool of individuals on island to recruit? Professional support like radiology, respiratory therapists, we have to recruit from off island, including doctors, and that can get costly. because we have to then offer them really competitive salaries to bring them on board, such as even sign-on bonuses that we don't normally do. DOC inpatient admissions, this is another group of patients that come into the hospital, the inmates, and of course, they don't have any insurance, and so we don't get reimbursed 100% by DOC because their budget is also limited. So that's another cost, another challenge for us in terms of providing patient care. The IT infrastructure.
Sorry,
Yes.
Ms. Posadas, are you
Yes, ma'am.
saying DOC is not paying their bills?
The inmates,
DOC,
they're paying some, but again, they're not paying the full reimbursement. They're paying us to take care of those inmates at the on-site clinic, dispensing the medications that they need. The doctor then sees them on a regular basis for their chronic medical condition. But when they become critically ill and they come into the hospital, that hospitalization doesn't get fully reimbursed. We don't get full reimbursement because of their limited budget themselves, DOC.
all right, but we always try to include in somebody's budget, it used to be yours, now theirs, to cover, but maybe they're not being told the bill for this hospitalization. Are they billed?
They're
DOC?
billing us.
They are billed,
Okay,
yes.
all right, please proceed. What's the amount like for last year? Can you give us those numbers for different years?
I don't have that
Yeah,
number. I
just
can
let me know.
provide it.
Okay, thanks.
What's eating up a lot of their budget, because it's like 3.6 million going to DOC, is really the clinic, the cost
Operation.
for the clinic, but even the clinic costs have gone up, and we're projecting this year it's going to be about 4.1 million, but we only got 3.6 million. The appropriation went to DOC, so it will be short this year as well.
And the cost of those inpatient admissions really depends on the condition, the severity of their medical condition, and the length of stay that they need to be, or even probably even admitted to the ICU. So, but we'll get that data for you.
Okay, thank you.
Thank you. The IT infrastructure, hardware, software, and peopleware, a lot of our hardware are really old, and so we're trying to get them replaced. And as it was mentioned by Rodolin, that we were able to procure some firewall and some servers, but again, it takes time and money to get those replaced and upgraded. In that table there, it's just to kind of give you an idea in terms of our patient census, how many patients we deal with, how many patients we admit and care for. So that's just for an FYI, if you have any questions regarding that.
The SNF number, 91, for the entire year seems very low. I don't know, is that normal?
Admissions, those are admissions.
Okay.
But, the total census for the whole year is more than that.
How much? Oh, no, how many patients do you have at one time at SNF? What's your capacity?
We are capped at 20 accommodations because of our staffing situation.
20?
20 patients.
Oh.
We are capped because of our staffing situation.
All right, thank you.
Next slide. Any other questions for that? Okay. Although we are challenged, we do have some successes and we do have some wins. And the first one, we recruited the Guam's first and only gastroenterologist specialist, the one and only on island. And so we are very blessed and fortunate to have, and he's been quite busy. He's been seeing a lot of patients. We recruited and retained more nurses this year. Last year, I reported that although we recruited 44, we lost 79 nurses. This year, we recruited 40-some, and we only lost 24. So the retention is improving. Hopefully, we continue to see that trend, upward trend of retaining nurses. In terms of the UOG BSN graduates for 2024, of the 32 that graduated, we have recruited 12 successfully. That's the most, because previous years has been less than 10 that we will recruit. We reduced our travel nurses. At the time that I wrote this, it was 31. As of today, we're down to 29. So we're slowly tapering the dependence and utilization of travel nurses because it is quite costly. We were able to also, our nursing administrator and deputy nursing administrator successfully converted some of those travel nurses to be local hires on an employment contract. So hopefully we can continue that trend. We enhanced and expanded our medical telemetry bed capacity in the medical surgical. I mentioned that earlier. It's a slow process, but we're getting there to have more telemetry beds, because that's really the demand. When patients come into the emergency room with heart conditions, they need a telemetry bed. So we want to increase our telemetry capacity. And that we recently commissioned and launched the new state-of-the-art ALIA Angio Suite, as it was mentioned by Ms. Rodolin. And recently, we received the Bronze Medal from Health Quality Improvement Contractors Recognition Program for improving the quality and safety of healthcare. So, as mentioned again, we do have some successes, and really, our employees at the hospital are so committed and dedicated and just motivated to continue providing the best care that they can, even with the limited resources. So, thank you, Senators. If you have any questions, we're here to answer them.
Jesus Masi, I appreciate your presentation and that you're all here for questions. I'm sure my colleagues do have some. I have a couple. One is, have we heard then your plans for FY25 Department of Interior or Department of Defense funds? Those are all included here for FY25?
Yes.
Okay. And then the payables, how do you plan to pay off your payables?
We're making payroll, and we are current with our retirement obligations. In terms of the withholding taxes, DOA has just informed us that they will cover what we were behind, and also the health insurance.
One of the things that really hurt our cash flow this year was having to pay back that Medicaid advance. So now that we're pretty much complete and we're done with it, we think we can pay the vendors a lot more quickly because it really frees up a lot of cash flow.
All right, and then I brought this up to your attention, the auditor saying that GMH is holding up our entire GovGuam audit because your audit's not done.
That's not true.
Well, they said GMH and DOE, but GMH's part, not done?
We've been finished since, actually since June, and then there was some issues that the auditor brought up after that we needed to resolve as far as findings that were never brought to our attention. In September, we were all done. Lillian and I signed the rep letter since September 30, and now there's some delays again with the auditor, but they assured me this morning, they called me and said the audit will be out this week.
Okay, great. Is there anything that we need to do to prevent any delay next year? We need these audits done before we do budget. Is that possible?
Yes, it is. We've always been ready. It's just been kind of a waiting game sometimes with the auditors, and we understand they're doing all of the government audits, and so they are also probably restricted resource-wise. They probably don't have enough people, and so we wait until we really thought we would be done by June 30. So when all these issues came up after June 30, we were really caught off guard. We were very surprised.
All right, so we just closed out our last fiscal year. So what do you anticipate for the FY24 audit?
We always plan to issue by June 30th, but it's really been possible to do it by March or even April. If we can just keep it rolling, we can't be waiting for requests to come later on down the line. We need to see everything up front, and we have the staff are always dropping everything to attend to the auditors, so we're always ready.
All right, and then, so if you proceed with your plan, you're going to be able to pay your payables. There won't be a request for supplemental. Are you able to do all this without that 20 million that we've been talking? No. So
No.
with the 20 million, you are able to do all of these
We
plans?
really need the 20 million. With our projected revenues right now, it would really only be enough to cover payroll and not even cover the doctor's pay, just a little bit after, because payroll alone is going to be 130 million. We're projecting our revenues to be at around 134 million. So we really need the extra 20 million just to get through everything else.
All right, and the amnesty what is the goal? What are you looking to bring in, or?
We're trying to be creative with how to move collections, and so this is something that was actually done by GMH 10 years ago in 2013, and they raised about almost $500,000 in the time that they were able to offer the amnesty program to self-pay patients. So we thought we'd revive it. It's 10 years later. We definitely could use the help with the cash, and we're constantly trying to find ways of moving the receivables on our books, especially the self-pay. So this is just an idea that we came up with that is not new to GMH.
Okay, so self-pay is even insured? No, these are only the non-insured, no insurance at all. So,
Yes.
Okay, and then you have another plan later on. Well, and you're hoping to bring in $500,000, you said, for self-pay.
In 2013, they did bring in about $500,000, so we hope to bring in the same amount. In the first few days we've had the project open, we've had a lot of inquiries, but no payments yet. So we think people are asking about their accounts to see how much they owe so that they can make arrangements to get the money to pay it off.
All right, and then for people who are insured, but that part of their bill was not covered by the insurance companies, how much do you have of those total?
We have a lot. For those patients, most of them are put on a payment plan if they need to, and our payment plan is so flexible. You don't have to pay a whole lot every payday or every month. As long as you keep the account moving, we're very flexible on that.
All right, but you're anticipating in the second quarter, meaning in January, coming up with another program for those people, hopefully?
For those that do not have insurance and they don't qualify for Medicaid, so
No
usually,
insurance.
if you don't have insurance, you will qualify for Medicaid if you apply and finally get approved. But there is a group of people that may not even be covered by Medicaid as well. So we want to give them also an option to pay their hospital bills at a discount on a sliding scale.
Both of the programs, both the amnesty program and the one proposed for next year, are for those without insurance.
Okay. All right. What about for those with insurance that have unpaid bills?
Well, they are either on a payment plan or they pay their share.
Okay. All right. So with the 20 million, there will be no threatened services cut. Is that correct?
We don't want to.
All right. And the hiring freeze, what's the status of that?
That was something that we had discussed earlier in terms of looking at how can we live within the 37.7 that was approved. And so, as Yuka had pointed out, she identified some areas in terms of like 50% funding for those vacant positions. But if we get that 20 million, then we can then fund those vacant positions so that if we need to hire them, we can then hire them.
All right. How does it impact nurses? Are you still trying to hire more nurses? You're not cutting any of the funding for the nurses, right?
We need to hire more nurses, definitely, and
Okay.
absolutely.
That
We
will-
will continue to hire.
All right. And the maternal child health project, you outlined in this presentation, search in progress on it. When do you expect it to be completed?
We're looking at a year after award.
1 year.
Yes, ma'am.
So, and you're looking to award that when?
Soon.
Our hope is that we would put out the solicitation, because we would have to put it out as an IFB, and hopefully award before the end of the year, so by December 31st. So then that way they can start the project by next year. Because again, it is a big project and it's going to be in phases.
You said IFB, is that already prepared?
We are working on a draft currently, and so the goal is to issue that IFB soon.
And 1 year, and we talked about it in detail. Just remind us again, when that's completed, how many, we're going to have that neonatal NICU, right?
Yes.
Expanded.
ICU expansion. We're going to have labor and delivery rooms.
Expansion also.
Expansion.
Correct.
All right. So 1 year from January, that would be January 2026.
That's our target.
All right. Is there anything that you think might delay your IFB?
Contractors?
Availability of contractors, ma'am?
Yes.
All right. But it hasn't been yet submitted to the AG, right, the IFB?
No.
Will it be? Does it need to be?
We're working through that process, and I think we're waiting for the certification of the plans. The 2019 plans were being recertified, and once we get that, we will review that and the total costs and parts and determine what needs to go through the AG's office, the governor's office, and GMH.
Okay, but all of that has to be done before like November in order to get your IFB back, or your bids back December, right? And begin in January, I hope. So that's going to be done. All right, and then the hardening of the facilities for the typhoons, that's the, what did you call it?
Envelope.
Envelope, yeah.
Yes.
And when do you expect that to be done?
So it's in active solicitation at the moment. There are 2 bids out, one for the 3rd and 4th floor, and the second one for the 1st and 2nd floor. The bids are due at the end of this month. And so again, because we are using ARPA funds for that, we are hoping that we can award all of that before the 12/31 deadline for ARPA obligation. And if I recall, the IFB calls for a 12-month completion for each of those projects.
Okay. There was an article in the newspaper recently that says, September 30, 2024, GMH cash crunch threatens to halt non-emergency surgeries. I've heard that this is no longer an issue. You've obtained the supplies that you needed from either using the $5 million that you received in advance, or Dr. Nyame, Dr. Virad Nyame, right? You said that you had also obtained some of these supplies from other sources. GRMC messaged me that they had also shared supplies for this purpose, but it seemed like it was antagonized by the being behind on the vendor payments, and some of this is because those vendors just won't give you the supplies, right? And okay, do you believe we have solved the problem, or are we just going to continue to operate like that, where we get
We don't
maxed
want to
out?
operate like that, Speaker, but, the situation that we were in, realistically, fortunately, as I mentioned, it was averted when the $5 million was advanced from the pharmaceutical fund that was appropriated by this legislature for fiscal year 2025. So that $5 million helped pay those vendors, about 14 vendors, and so they've got their payment. But it's an ongoing process. We continue to order these supplies because we need them. And so hopefully we don't get to that point again of, suspending elective surgeries. We don't want to do that. We don't want to cut any services.
All right, are we limiting supplies? Because in the article it says sponges are being limited for bleeding patients in surgery, hospitals running out of linens, patients are bringing in their own towels, face cloths, supply shortages, and are we still doing this?
Buenas señor for day, Chairwoman Speaker. This is Quasi. I'm a neurosurgeon at GMH. We're not limiting supplies. We're just trying to use it more efficiently. So we're telling our doctors and our staff that while we wait for our supplies to come in, to please be mindful of not being wasteful. So it's not a limitation of supplies, but just being efficient.
So if I ask the nurses to come in here and tell me that they're receiving their supplies, they would say yes, they are? Because they did not say that the last time.
It depends on the supply, ma'am. The supplies that currently we're not short on, we give. The supplies that we don't have, we have to find creative ways of trying to get them. For example, being grateful to GRMC by having them lend us our supplies, going to Saipan. We find ways to make do. But right now we have some supplies to be able to go forward.
Do we have all the supplies that are in demand right now?
Yes, ma'am.
Yes, Dr. Borja, please Please come to the microphone. There should be a seat in the end here.
I was the one who said I was being limited in the operating room, and that was quoted in the PDN in the Post, or whichever newspaper. I was the one that said that, you know, I was, not that I was being limited, but I guess I use those words. I was being limited on sponges, and at the same time, I had patients on the floor that did not get their linen, so one patient and family asked me if they could bring their own towels and face cloths and stuff like that. And we did say yes, you can bring your own face towels and whatnot. Just can't bring in your own blankets. But I was the one that actually said that during a board meeting because I found that very alarming. The scrub tech, they weren't saying, oh no, you can't use these sponges, but we were kind of limited on the surgical towels and lap sponges, but we had enough to get through the cases, but that made me very concerned, so I brought that before the leaders at the meeting. But at this time, I continue to do surgeries, and we are not limited. We've had a shipment of linen, of scrubs, and my patients now have their own gowns that they can wear, as well as the towels and stuff. So we are not having any limitations right now that I'm experiencing. But that came from me.
All right, you're right.
Yeah.
They do.
And we do have shortages, to be honest, to be truthful. We do have shortages, especially when we are behind with paying the vendors. Then they don't deliver the supplies or they limit us.
All right. Again, that's why I asked, what is your plan to pay these vendors? And you're saying, if you get the 20 million and according to your current plan revenues, that you will be able to pay these vendors as you go along. You will not get behind again, so we're scrounging for supplies?
We still have a payable, as I presented, as of 9/30. It's about 14 to 15 million unaudited. That payable is still something we owe to vendors carrying forward into the new year. So with the 20 million, it will, because the budget is for the whole fiscal year, but we're entering a budget year all the time with the vendor payables. Yeah, we already owe this to vendors, so we will have problems paying because we'll only have enough to get through the fiscal year, but we're still carrying the burden of the prior fiscal year.
So the 20 million doesn't cover the vendor payables, but your revenue might?
No.
It will not. So you know that already.
Our revenue projections is really just for FY 2025. We're budgeting for the whole fiscal year, but because of the fact that we're entering the year with we're $15 million in the hole already entering the fiscal year, what's going to pay for that? I think we're good for the fiscal year as a whole. FY 25, I projected a $24 million shortfall. If we get the 20 million, that really takes care of most of it. But we still have this 15 million that we're coming into the new year with that we owe vendors.
So the shortfall 24 million does not include the vendor payable?
No, it does not. It's really just for the fiscal year, for the 12 months.
Does the governor know that?
I haven't had a chance to sit and talk with the governor.
Because
but we do
she's
have a meeting
also
next
only
week.
advocating for 20 million, right? And so, yeah,
We're meeting with her next week.
we tried to get rid of that vendor payable so that we don't have patients calling all of our offices talking about the supplies that they hear about. All right. So, Ms. Echanova, you were also quoted in this same article saying you are helping the Guam Economic Development Authority review bids for hospital consultants, which will help GMH improve billing and collections, among other things. What is that all about? Is this different from the Med Farm consultant regarding billings and collections? And what is this?
This is an RFP that GIDA put out for a hospital consultant. in order for us to be prepared when we move to the new hospital. That's the way the RFP was written, is to find a consultant to make sure that GMH addresses the issues right now before moving into a new hospital. And so the evaluation of the proposals is actually scheduled for tomorrow. And this is a GITA-funded consultant.
And then what are they going to consult on exactly?
The entire operation of the hospital to make sure that it is really ready to move into the new, so that the problems we're facing today don't move to the new hospital.
Are they a management consultant?
It's just looking for a consultant, either a person or a company.
Is this going to be Matrix again? What is this? Come on, you guys have to be honest with us. What is this going to achieve for you? Where does the money come from? GITA?
GITA.
What money? Is that the DOI money?
I don't know.
DOD money?
We don't have privilege for that information, but yes, it is a GITA RFP to assess the hospital's fiscal and operation services, is what we understand on that RFP, because we do have a copy of that RFP.
Okay, I'd like to see that. So we also, are asking you about this RFP for management consultant. It's supposed to be a management operations partnership, right? The task force several years ago came up with. Okay. That's what they were looking for. And so I'm wondering, this consultant will consult on what we need in a new hospital, or
it's going to assess our current fiscal and operations processes and structure to see then what needs to be done to ensure that when we transition to a new hospital, that we resolve those issues and processes and strengthen them. But I don't understand it to be a management consultant.
Okay. Because the fiscal, there was a fiscal team put together, remember? And supposed to consult with GMH over the last year at least, since that 30 million vendor payment we had to make. And they were supposed to do the same thing, it sounds like. They were supposed to tell us, the fiscal issues. And we've heard from you, I think, over the years, what the fiscal issues are. It's the Medicare reimbursement rates, it's the social cases, it's all the different things. It's those that are not on Medicaid that could be. We're supposed to be working on that. The EHR system is a huge one. But I'm curious what amount that is going to be for this consultant. And when you've got an EHR system that you said you're unable to fund, so you're unable to proceed with, that's in the documents that you sent, so those have been distributed to my colleagues, that we are not getting a new EHR system because we have no way to pay for one, right?
We have the RFP drafted already, but we can't issue it because we have no funds to certify it.
That's right, and the amount projected was huge.
Correct.
And you're still paying for the one you have.
Correct.
All right. Okay.
Madam Speaker, that committee that you're talking about, is that the fiscal review committee that the governor?
Yes.
Okay. We do meet with DOA and BBMR.
So she, by executive order, set up a fiscal review committee to make sure we didn't end up in the same place again, which it sounds like we are, right? Instead of 30, though, it's 15 million. That's a little better, but still not good. So you're saying even if we give the 20 million more in your budget, we're still in the whole 15 million to vendors, which is very concerning for so many reasons. All right. Are you familiar, Dr. Borja, has the board been briefed on this GITA consultant, what they're going to do for the hospital, if anything?
I think that was just brought up on the last meeting, but we don't have any more information on that. But as with any institution, when you are coming from an antiquated billing and collections program, whatever program that we use at GMH, I think it behooves us, before we move into a new facility, that we upgrade a lot of the programs that we're using. So this management consultant, and typically it is a person, would review our processes and help us transition from the old facility. And if we are going to use a new program for billing and collections or update the current one that we have. In a private practice that I have, we have to upgrade our LIHTC capability like every 2 years. So GMH, because of the limited funding, we use what we have until it's dead. So going into a new facility, hopefully within 5 to 7 years, we will need to be up with the program with billing and collections. It changes every year. There are updated codes, updated CPT codes and billing codes. So this management person will help us transition and...
So they're going to help you pick an EHR system?
Not EHR, it's the fiscal needs, bringing
I thought
us
you
into a
said
new
your
facility.
EHR system, the why you didn't like the one you have was because it didn't interface with your fiscal part and your billings, and that's why you're going to convert the EHR system. But
It does interface. There are some
there's a way
drops.
for it to do that, right?
There are some areas that it's not interfacing. I guess that's the thing, is to say
Right.
that it is interfacing. It's not 100% interface, and we do have areas or pockets of time where it will drop, and then IT has to come in and resurrect
Right.
it.
But you were saying you needed a new one, right?
Yes.
And that sounds totally different than what Dr. Barr just described, that this RFP is going to get you some other program for other purposes.
The RFP is really just for a consultant like what Dr. Borjas, to get us ready to go into a new hospital. It's not just focused on fiscal, it's operations as well. Are we as efficient as we should be? There are a lot of processes in the hospital that are not just fiscal, just billing and collection. There's things like housekeeping. How do we schedule the housekeepers? Where do they go? Security, are these services that we need more people? Do we need less people? There's just so many other things that need to be looked at to see if, for one of the things, if we're being efficient and are they necessary even.
What was the Med Farm contract for?
I think you're talking about the MedHealth.
MedHealth,
Mouth
yes.
health,
that
right.
one. The one that the auditor,
When we initially issued the RFP, it was to help us with our billing and collection so that we can increase the revenue collection. That was the intent of that consultant. They helped us for a little bit, for a little
Okay.
while, but unfortunately, we weren't really getting what we needed, what we expected.
so
from
that one was how
consultant.
much?
4
million.
About 4
All right,
million.
and then this one is going to be for how much, this consultant?
We don't have the amount, Speaker, we don't know
But
how
they
much.
issued an RFP,
It's an
they're
RFP,
already.
they don't put an
They're gonna
amount.
award it, sounds like, in the next, you're gonna review this, what's been submitted, right?
But an RFP doesn't-
I asked to be put on the evaluation committee because we were not involved in it. And
Yeah,
we were
isn't that
surprised
strange?
to learn, and so
Okay.
that's why we just asked, well, can at least some of us from GMH sit on the evaluation committee? And so I was put on the
All right,
evaluation.
so you don't know how much was budgeted for that,
No. I
or the
don't.
source of funding?
And an RFP, you don't identify an amount, but you certify an
Right,
estimate.
you have
but
to
we
have
don't know
an
how
amount
much.
before you can issue an RFP. Okay, so we don't know that, and, so Gita, all right, I'm just curious, because you are in need of cash right now, if they have funds available. All right, thank you. I'm gonna open up to Vice Chair Joanne Brown, Senator.
I don't know what to say at this point, Madam Speaker. I think we're going to want more clarification with regards to this, because so far, that particular issue with the last collection company was questionable, and the process under which the hospital obtained those services. And then even the patient system that you guys put in place that we were told a few months ago was not working to its intended purpose. I mean, can you imagine for those on the outside looking at this, looking at GMH, it doesn't give us a lot of confidence. And now if you have to figure out how you're managing your housekeeping and whether or not you're doing it efficiently, then I've got to ask, what is your management team doing? Because lately, I have to tell you, we're very concerned about how things are running, and we also know that there's outside interests, obviously, that want to siphon as much of the people's money as they possibly can. And GMH just gives example after example how to do that. We gave you $30 million last year. The governor threw in exchange 20, so that's additional $50 million, if I recall. And it is now a year later, and we're back in the same situation. I understand the fact that, you do have to assist patients that don't pay, and even if you go back to get reimbursements, you're not going to get your full 100%, and we recognize that. But these contracts are sometimes questionable. And I don't know what the future is going to be or what the policy is going to be, or if we're simply going to transfer this current structure of GMH management to the new hospital, or do we just change it out altogether? Because I'll tell you, I've been here long enough, I've heard this story long enough. I've been here when we borrowed money from the bond market to keep GMH operating. That's just wild, that we would borrow money that is going to cost us how much more just to keep GMH operating. So I think this begs the question for us, and certainly maybe the next legislature or two, to look at how do we move forward with GMH? How do we maybe redesign it or restructure it, or actually get a privatized management team that has expertise in hospital management to take over? Because otherwise, I foresee we will continue in the same cycle. I'm bothered by the fact that you're telling us you're not on this committee or whatever with Gita. If Gita's doing this without your request, did you request Gita to do this for you, this contract for this hospital specialist, whatever, to come in and reevaluate you? And the reason I ask is because when this whole issue of the new hospital came up and the location of the new hospital, we asked board members that were being reconfirmed. And they came back with a response of they were unaware. So if you have the key people, which we're assuming should be the decision makers as the board members of GMH, are unaware of these external decisions being made and being imposed upon GMH, then we get a lot of question marks in our mind. Why is that the case? That just doesn't seem right. It seems very backwards. I mean, you guys should be driving, the board should be driving that agenda. And it is a legitimate question by the speaker. Who's paying for this? If Gita's paying to put this forth, are they going to continue to pay for the services of this individual or company that's going to come in and do an assessment of GMH and provide these recommendations? It just seems disconnected. It doesn't make a lot of sense. I'm sure too, I don't know, maybe anybody here at the panel here thinks it makes sense. Doesn't make sense. If I can, yes.
Every fiscal year we will be underfunded. We are GMH on an island in the Pacific, and these Pacific islands, including GMH, our people, all come. Someone said this is an autonomous agency, you should be running it yourselves, and I question management on how it's being run. It is not an autonomous agency. We are a semi-autonomous agency. We are a public hospital. I likened it to one of the internships I did as a resident at Cook County Hospital, Chicago. They had curtains separating the patient rooms, but yet they were still a level 1 trauma center. And that is a county hospital. We are similar to that. I think the training that I got in Chicago was very good because it prepared me to the situation we have at GMH. 50 years ago, or whenever Jesus Leon Guerrero wrote that book about the hospital, it is still the same story. It's still the same story, and you cannot blame us. We will always be at a deficit because we are taking care of all these patients, private, uninsured, self-pay, anyone. So when we start out underfunded every fiscal year, we can't totally be blamed, like, what are you doing? You're back here again? We will come back every year because we are underfunded. And if you take the board members, we have a 6-year term, but actually every time a governor changes, we are going to give a courtesy resignation. So everything that we have done, in 2010 we got Joint Commission accredited, and she was on the board, I was on the board. The stars were all aligned because we had Lieutenant Governor Mike Cruz in office, we had a leader like Dan Webb, who passed away during his leadership. So the stars were aligned for us, and GMH, and it can do it again. That's the thing that's so mind-boggling. We can do it again, but we cannot maintain it when we change every single governor. So we are at the whim of who's in office, and we are caught between the legislators who work for us, and we work for you, and we are caught between the governor who works for us, and we work for them. So we will always be underfunded. So you will see us again next year. I promise you. Because
I understand your point.
Yeah.
I am not arguing the underfunding. I think that's a reality that we're well aware of. But at the same time, I don't think that can be used as an umbrella to address whether or not and what type of contracts the GMH is entering into, or even some of the other abuses that we are hearing about and have been happening for some time.
Well, we are a political hospital, so whatever happens...
As because you choose to be.
We don't choose to be.
I have to tell you, I don't know. If I had a 6-year term, I would complete my 6. Did you ever check the legality of having to step down? If
We
you have a
know the
6-year
legality
term, if you
because
have
under the Organic Act of Guam, the governor has the power to wipe us out. So if we don't give the courtesy resignation, they will fire us as they did in 2010. So we are a community hospital, and whatever resources we have, we use it. And whatever we can upgrade, talk about the EHR. The EHR, we've been using CareView for 2, maybe 3 years, or whatever, however long. But even that gets outdated. And we have a plan for getting another EHR and getting up to speed with all these services that we are providing. So we are going to find the funds to do this new EHR within a year, hopefully within the year. So whatever they say we can't, we will. You know, we will update our billing and collections and our fiscal, especially going into this new hospital. But forget the new hospital. Hopefully, none of our people will be injured in this old hospital. And what are we waiting for? You know, but the procurement laws also limit how we can do all these things. So we're going to do a request for bid, but, you know, it takes 3 months. We'll get the bid awarded, and then it takes another year. But we are there now, and so what is being done to protect us in a facility that's that old? So these problems are all over us, but we still keep coming to work because the patients. So I'm sorry, we will be here again next year.
I don't argue any of that, but at the same time, when we start hearing about contracts, if GMH had a better, track record on these contracts, then maybe we wouldn't be questioning. But by all means, on behalf of the community and the people that fund this, yes, we have every right to question it. We had questionable issues with regards to the public. It's not I who made that decision. The public auditor made that decision with regards to the last contract the hospital entered into to do collections. This issue, we kept saying, oh, this patient's information system is going to be the savior of us. We're going to be able to just plug it right on in, keep track of every service we're providing, everything in the billing, and then we end up getting feedback. Oh, we spent a few $1 million, and this system's not designed for us. It's not working for us. I didn't make up those words. They came from GMH, at least those are the statements that were made publicly. So we see stuff like that, then by all means we have a right to question the management and the effectiveness of what's being done. I understand there are patients that need to be taken care of, and that need is today. All this focus is on this new hospital that doesn't exist today to help patients that have that need today. Certainly you in your capacity know that. But we all hear about this new hospital that's way down the road that may or may not be done, may or may not be built, because there's so much policy disagreement about whether that's going to be done, but the governor says she's going to do what she's going to do without concurrence of this body. And all that power and control of money is probably what's going to lead to the problems that are going to come out from this administration, because they had all that power and all that money, and we will see and hear in the not too distant future, hopefully, what they've done with it. We have every right to ensure and question accountability and making sure that money is properly spent, but we do hear about those areas where it may not be misspent, where there's contracts that may be a little more than they should be, maybe even more than the national average of what we're paying people. So we've got every right to question that. I'm not arguing the need for the money, but we got to make sure what money is going into GMH is being properly spent. And that's not always the case, like education. We put the umbrella and say, oh, if you question us, then you don't care about people's health care. Oh, if you question us, you don't care about the children's education. And yet we see abuse. We see misuse. We sometimes see corruption in the involvement and engagement with what's going on. So by all means, we get to ask this. We even question in terms of personnel, who's being hired where and for what? Are they necessary? What do they contribute to actual patient service? We've got every right to do that because we've seen abuse in this in the past. I'd like to think it doesn't exist. And you're right. GMH did attain accreditation. The very people that were successful in doing it are running the hospital now. The governor's the governor. And yet, I will tell you, anybody could be running GMH right now to see where it's at. Is it any better? The story to me, as I hear it, is no different. And I've been here at least 30 years ago till now. And the story of this cycle has not changed, at least from my perspective and what I'm hearing. So by all means, on behalf of the public that we represent, as imperfect as we may be, we got every right to question that.
And if I may interject.
Sure.
Under my leadership, there's no abuse. I don't do any abuse, just so that you know that, for the record.
I give you
I do
credit,
not witness
Lillian.
any abuse,
I hope
and I
that
do
is the
not
case.
encourage
I'm
any
not,
abuse.
I will not
Thank
question
you.
your integrity to say that you're not doing abuse, but if you don't think anyone else in your operation is, then more power to you. I could never say that operating a major operation in this government. I would never say that. Because unfortunately, people make decisions and greed motivates like nothing I've ever seen in this government.
Yeah. If I may, I think you missed my testimony, but let me just tell you some of the, I'll make it very brief, if I may. Some of the accomplishments, I'll read it very quickly again. August 2024, and I tell the hospital, you need to celebrate this. This is so hard to do. August 2024, the U.S. News and World Report designated GMH as a high-performing hospital, placing it among the nation's top hospitals based on performance across various medical conditions and procedures, which includes a treatment of heart attacks, heart failure, diabetes, chronic obstructive pulmonary disease, and pneumonia. U.S. News and World Report evaluates approximately 4,500 hospitals annually across the United States. Of these, only 38% earn a high-performing rating in a single category. This is major. We are in that 38%. In July 2024, GMH received the AHA, the American Heart Association's Get With the Guidelines Resuscitation Bronze Quality Achievement Award for its up-to-date research guidelines for treating in-hospital cardiac arrest. In addition to the Resuscitation Award, GMH has also been honored with the Get With the Guidelines Stroke Gold Quality Achievement Award, recognizing the hospital's commitment to ensuring stroke patients receive the most appropriate treatment according to the nationally recognized research-based guidelines. In September 2024, just this past month, GMHA received the Health Quality Innovators Hospital Quality Improvement Contractors Recognition Program, which recognizes our commitment to improving the quality and safety of healthcare for our patients, providing person-centered equitable care, and producing better healthcare outcomes. The GMHA skilled nursing facility in Barrigada has received the Achievement in Quality Award from the Quality Improvement Organizations, a program for the Centers for Medicare and Medicaid Services. This, I believe, has been achieved without even being accredited by an accrediting body. But I tell the people at GMH, we need to celebrate this. This is a huge win. It is a reflection on what we are doing. This puts it in quantifiable terms for people to understand what we are doing there. So 20 million is not enough. We all know that, right?
No, I'm telling you, this is where the issue comes. And so you want to tell us we're not paying attention. One of the doctors was quoted saying the legislature doesn't know what's going on. No, I don't think we're all aware of the history of GMH's budget deliberations either. They come in year after year, they ask for 0 in capital improvement projects, they get behind in capital improvement. They come in last year, the governor asking for 1 million more than FY24. Ends up, they needed like 47 million more than FY24. That's what happened. That's what's happening. It's not just So when we say it's political, that's why. It's because these messages are all messed up. They're mixed up. They're not consistent all the time. No one here is saying GMH is not doing a great job, especially
we
under
don't
the
want a
circumstances.
pat on the back.
So we're saying
we need our subsidies.
We are trying to do that.
We do not want a pat on the
Doctor,
back.
that's what we're trying to
This is just telling
do.
you this is the evidence of what we are accomplishing.
I agree.
Yeah.
And I'm
So-
very, very happy and proud about that. And you deserve more than a pat on the back. You also deserve money, but I'm trying to help you, and I'm trying to tell you what you need to show. And we need to show that we know what we're doing when we're hiring consultants who are supposed to be helping us, when the auditor's saying that was a waste of money. We need to know, why is Gita hiring a consultant for hospital operations and fiscal things when we are trying to listen to your fiscal plans? Do we not know what we're talking about? And Gita's going to try to tell us what we should be doing differently instead of you guys. It's that. So it's nobody at fault in particular, but there is a system of inconsistent messages and not knowing what's going on. This is the thing. I want to know how much is going to be spent on that RFP on a consultant, and whether we should be listening to your plans for how we're going to take care. We're telling everyone we need 20 million. The governor finally came and said she agrees. We need 20 million. You're saying we needed a lot more. Well, then get the message straight, because Lillian just testified the other day that 20 million was going to be enough. We're only hearing today for the first time 20 million is not even including the 15 million. This is what happens. So it's the messaging, it's the gaps, we can't get straight between GMH's presentations one time and the next time the legislature, information we are getting, what Gita's doing, I don't know what they're doing. You're the board, you don't know what they're doing. This is a problem, I think. We should all know. We should all be on the same page. So,
Madam Speaker,
we're
what we
trying to
requested-
recognize your efforts and do what we can to support them by, right now, we're looking at money. We're having an oversight to see what were your plans. You said you were going to cut down services. You're saying now you don't have to, especially if you get the 20 million. So that was what we were concentrating on. Now, on top of that, you're throwing in, but now we're still going to be 15 million. That means, to me, we're going to have nurses and patients still calling our office, telling us they're not getting their supplies, or they're being threatened that they can't use this, can't use that. Remember the nurses come in here telling us they didn't even have, what was it, diapers or something, and we had to do a diaper, what was it? Wipes. Yeah, I mean, that's why we're confused, right? So if we're going to maybe we're just going to ask you one more time.
Well, let me clarify. What we requested for
Yes.
fiscal year 25
We know what
was
your
74.
request
But we only
74.
got approved for 37%.
The
so we're short
legislature passed,
37.
that's
If you
correct.
could give us 37, that would be great, but you're only giving us 20 million, we'll take it.
We don't even know we're giving
take
that.
it.
We have to convince 15 colleagues of mine to give GMH that. That's
So
one of
give
the
us the
reasons I'm
37
having this
million.
oversight, is so you can do that and be consistent, whether
Give
we
us the
need that
37
or you
million then.
don't.
Thank you.
Right? But you said, this is what I'm saying, at the last hearing, you said, yes, 20 million, you said 20 million.
we'll take it. If
Until the
that's what
very
you can
end,
give
when
us,
you
we'll
said the
take it.
15 million is not covering. That's a whole,
Well, 74 million on our budget request, it's all outlined in there. But since it's cut by almost 50%, what do you want us to do? You want a walkout of all our people? I mean, how much more do you think we can take? We requested 74 million. We got 37. What do we do with that? We are providing GI, the first GI on Guam. He has billed 30 more cases a month. He is cranking it out because these people have GI problems. That is a major thing. And if you want us to cut services,
I don't. I
No,
don't know
you
why
don't
you're
wanna-
telling me that,
well,
doctor.
because
That's not
37
me.
million
I think I
is
need to
cutting
interject right
services.
now.
That is, no, doctor.
37 million.
You need
Give
to
us
just get it
74
clear.
million.
I agree.
Okay,
The
Doc, we
legislature
agree.
should give you that money. The
We agree
legislature.
you need to get $74 million.
Senator
But the
Brown.
fact of the matter is, Doc, is that when the budget comes here and the budget doesn't reflect what you want from the governor's office, then we got to fight amongst ourselves and we got to figure out amongst ourselves where in the governor's budget did she give us the room to be able to give you the money? That's the reality of it. It wasn't us that cut the $74 million out of it. It was never included.
But we requested 74.
You did request, but then we had to work with the money, we had to work with the budget that was given to us by the governor, which didn't reflect that. No, look, not only your $74 million, but the $2 million that was supposed to go to cancer care, okay? The measly $500,000 is supposed to go to DISIT. And yet we were assured 2 years ago, when so many pay raises and other things that were occurring within this government, that don't worry, services won't be cut. Don't worry, we have the money to do this. And now we're sitting in front of you and you're begging. I know, we understand your plight. We understand it. And when the speaker talks about the mixed messaging, when you come to us and say we need $74 million and we're looking at the governor's budget and it doesn't reflect that, where's the priority? Then we become the bad guys because we have to go find it and we got to cut other people. So we're fighting amongst ourselves for something. You need it, we know you need it, we're looking for it. But the messaging that was coming from the front, the messaging that's coming from Madalup, is it's not a priority. It's not your fault. I know your plight. We know your plight. Didn't even tell you about the Gita contract. Why do we need to know about something that's going to happen in the future? What about now? We don't want these problems to follow us into the next, into a new hospital. What about the problems now? Fix it now for this hospital. Said enough.
So thank you. This is where
Thank
the
you, Senator.
legislature can come forward and say, okay, let's give the hospital the $37 million that is short.
That's what we've been trying to do.
Okay, we'll take the $37
Right?
million.
Some of us have been trying to do that, not all. So this is why I'm calling this oversight. If you want to make your case, let's make it. Help us, help each other, but we have to be consistent. Otherwise, they will poke holes in every request that we have as being inconsistent, maybe not necessary, right?
So our case is
And so
requesting
when
for
you
$37
came in the other
million.
day and saying 20 million's enough, and the governor says 20 million's enough, now we're saying something different. That's really all I'm trying to say. That does not sound consistent to me. Senator,
It's up to the
Joanne Brown,
legislature.
were you
The
finished?
legislature has the authority.
Can I finish my comment? Or no worries. I totally empathize and understand where we're coming from. I mean, we're a week and a half into the new fiscal year. And I brought this up before, and it's coming. I mean, you might say I need another $35 million, like we can pull it out of the sky. But this should already tell you an indication of what's coming, which we anticipated. With all this bragging of additional excess revenue, we are a week and a half into the fiscal year, and we are already in the hole. So I don't know where the administration wants to propose the additional $20 million is going to come, or where they want to cut in the budget, because DOE's here with another $49 million. And that's just the beginning. We don't even know what's going to happen with the rest of the government of Guam. I mean, you're asking $20 million. There are government agencies, whole government, entire agencies that operate on far less. Do we wipe all of them out? I just think we need to be mindful. There is not an endless amount of money, and I think the crunch is coming. We're starting to feel it. The fact that we are looking at a supplemental budget that's publicly heard last week, and we hadn't even started the fiscal year, should tell you what is coming. This financial issue is going to affect the entire government of Guam. We were very happy. We were spending an awful lot of money on temporary revenue, and that revenue is driving up. This is a reality that was anticipated. And yes, right before an election, we had all these humongous pay increases, and everyone was all good. We can cover it. We can cover it, no problem. I mean, because I didn't vote for it. A number of us here did not vote for it. I don't think anyone sitting here voted for this current budget. So maybe you're talking to the wrong choir. But they voted for it, they put it in place, knowing that this revenue was short-term, and they increased the government of Guam by another $400 million in the last 6 years. As far as we know, $400 million. 1.3, we're bragging, we've got a $1.3 billion budget. And yet basic needs, I think you would say healthcare is a very basic need, is not funded to the degree. So yeah, there's a lot, some say, oh, nobody's to blame. I say there's a lot of blame to go around. Because at the end of the day, things are not, I'm borrowing that word, at the end of the day, it's not adding up. And if we are already in crisis a week and a half into the fiscal year, it's going to get harder. So it's also a question to ask GMH, and I'm not going to belabor it today, but I think you really need to look at where are you also being more efficient in your operations? What are you cutting if you have to? Because that may not be so far away from the reality. I mean, you know, the chickens are coming home to roost now. You cannot increase the government by that level and expect to survive. Even with the build-up and we're going to get more military, it is not. The tourism industry has yet to revive itself even halfway to where we were in 2019. And that's the fiscal reality. Where's the money going to come from? Where are we going to cut? Where do we cut 20 million? We could probably have 20, 30 government agencies that operate on less than that annually. So I just bring that up. That's why when we hear things like this about maybe we need to, Madam Speaker, definitely get more information on this GITA contract, because there's visions happening outside of your operations and you as board members that should be the ones driving this. If you came to us and said this is what we're doing, and if GMH had a good track record with regards to these contracts, then we wouldn't be questioning them maybe. But this wasn't that long ago with regards to the collection agency and all the questions. I didn't bring up the questions. The public auditor brought up the questions. So much so that the company disappeared for whatever reason. Either you terminated them or they just disappeared, but they're not providing the service now. This patient issue, I'm kind of got a stickler on that because we kept hearing how that was going to be the great solution, only to be told, oh, this doesn't quite fit our needs. Well, who the hell evaluated that? Who decided we're going to spend $4 or $5 million like it's nothing and throw it to the wind and, oh, well, now we need to get more. You need to give us more money because we need a different system. Are you for real? We don't get that luxury to squander $4 or $5 million and, hey, we're still around. I mean, we would have been fired. So I think you just need to be mindful of that. We're not unaware or uneducated or not caring, but that's the realities that we're dealing with. And we have every right to question it, especially if the track record is not that good. Do you want to say something?
Yeah, I share a lot of your concerns. And I know I'm the lawyer for GMH, but I also have, you know, prior to coming to Guam, I have a master's degree in economics as well. So I actually genuinely understand the questions. And being more efficient in our contracts and other things. And this team has actually spent a lot of time trying to be more efficient in our contracts and assessing those things. But one of the economic realities is it's really expensive sometimes to be poor and underfunded because you end up spending a lot more money trying to get out of holes instead of actually being able to be efficient. And I think all we can do, all any of us can do, is come here and tell you the case as it is at GMH, that we see it from the administration day to day, and tell you what we need and how much money we need for that. And I think that's the case we're making. And I don't envy your job either. Budgeting for a whole government on a limited pie, that's not an easy job either. But, you know, our job is to come and advocate for our agency, which is one of those essential services. And it's going to cost us a lot more money every year if we're consistently underfunded like we have been since the inception of GMH, including at this current facility. And so what we want is to be adequately funded. If that's 20 million, it gets us a whole lot closer to where we need to be. If it's the 37 more that we asked for, then we can actually start to do some really, really cool things. But until we actually bridge that gap, I don't know where that gap is. But from GMH's perspective, we're putting out what we need, and we're asking the legislature for help in getting there.
Granted, and I don't argue that, but we have every right to question, especially if we see misspending and misuse of money.
And I absolutely agree. And if you have any specific questions or concerns on those things, please send them over, and we will respond and look into those contracts and other things as well and respond to any of the concerns on that.
Yeah. Anyway, Madam Speaker,
trust me, I share the skepticism about
Senator Brown.
contracts.
I appreciate your input. I just think that's something we need to be aware of because it's a concern. Money is going to get tighter. We're already starting to see the sign. Like I said, I've never seen this. And I've been at this a while. I mean, aside from Senator Tina, I've been here longer than anyone else here. I've never seen this in literally a week and a half into the fiscal year. We're already in crisis. It's concerning. And as I said, I don't think anyone here voted for that budget bill. the most recent one, and now we have a supplemental before us, and I don't think any of that really addresses much of anything for GMH, where those priorities are. So with that, Madam Speaker, thank you for the opportunity to comment.
Thank you, Senator Brown. Senator Taitakui.
Thank you, Madam Chair. I really wanted to jump in and say something, but yeah. Since 2019, every budget hearing for GMH that came in front of us from that time until just recently this year, this body, I know I did, and I know the Speaker did in the FY 35th Guam legislature, we literally begged you to ask for more money. We kept saying, are you sure that's all you need? Are you sure? That was 2019. 2020 came. You came in front of us again. Are you sure that's all you need? We think you need more money. No, senators, this is our budget. When the whole entire time you knew you needed more money. And hence, politics came into play. So I'm glad to see you're not playing politics anymore, and you're coming in front of us this year and finally telling us what you really need. And I think it was the doctor who had left recently who came in front of us and presented the budget and told us we got 3 choices to choose from. At least now we have a choice. It was a little bit different, and I appreciate it. But we have to stop playing these politics and ask for what you really need. I don't care what anybody says. Guam Memorial will always be in the red because it's a hospital for everybody to come in and you don't have to pay. It will always be in the red. But the one thing that needs to be paid are the vendors, because you will not get the supplies. You can do what you did here by cutting areas, salaries. You can, you can stop hiring, you can stop certain programs, but the vendors have to be paid, else you're not going to get any supplies. And the supplies is what you really need. I mean, how can you cut that? You can't cut supplies. You can cut other things, but you can't cut supplies. So $15 million is what you need for the vendors, to pay the vendors up, correct? And we also know that next year, it's going to be the same amount again. But you gotta ask for that money here before we go into budget. So 15 million, and then the 20 million is for operations, correct?
Yes, correct, for FY25.
FY25, okay, moving forward. A total of $35 million is now needed. So we made that clear. So all the media is not going to mistake in that. It's $35 million that Guam Memorial needs, 15 for vendors, 20 for operations. Okay, so that's clear. The other thing that I wanted to bring up was the 30 million that we gave you, the legislature gave you, that's all paid for. All vendors, that's all empty. That bank account is empty.
Yeah.
Okay, the 20 million that the governor gave you for art funding, okay, there was all, that has $11.5 million still available, correct? I mean, you're saying there's 19 more projects, but nothing has been obligated at this point. So it's about 11.5 million, correct?
Yes.
Okay, so you guys really need to work on that, okay? We'll do our part and advocate for that money, because any excess revenue should go to life-threatening areas, and that is the hospital and the cancer care. That's what that excess revenue should go to. Nothing else, none of these other pet projects. As far as GITA is concerned, with this whole contract that's coming up, I believe they're probably getting that money from the SIDS. You might want to ask Yuka if they're planning on getting money from a grant from the SIDS. It's a report they put out and they request for it. So I have a funny feeling it might come from that funding. On the proposal that you submitted to us, and I'm sure the speaker will probably have another round table on, or oversight or at least informational hearing, could we have a spreadsheet that talks about the ongoing work at the current Guam Memorial Hospital with what is funded by ARP, DOI, and local funds? Can you put that in? And then also the timeline on completion. That's so important. A lot of people forget that. When is it supposed to be completed? So the next time you come in front of us, we have a diagram. We can follow along. If you had it this time, the next time we had another meeting, we can basically gauge where you're at and why is it taking so long. So I appreciate that next time. Sure. Okay. And if you can do it before the next hearing and send it, I greatly appreciate it. Because many of us are continuing to follow along with the progress of Guam Memorial Hospital. Is there a plan to hire another collection agency?
Yes, as the last resort, after we go through
Consolidate.
the amnesty and then the discount, then yes, we will have to do
What is the
something
amount
with
for that?
The gross self-pay right now is over.
No, I'm talking about to hire a collection agency.
How much?
Yeah, what are they going to request for? Is it like a certain percentage
I
of the?
feel like the going rate has been something like 20 or 30% of collections. That's what I've been hearing on other research areas that I've done. Is about 30, even 33%. They usually take a third of the collections.
And the average amount that needs to be collected every year that you're seeing? I know you've done great progress already on collecting overdue bills, or collecting those.
It's really just the very old accounts that it's very hard for the staff to do anything about because they're so old. Phone numbers have changed, addresses have changed, people have died. I mean, it's just things like that that we think should probably go to the collection agency. For the more current accounts, yes, they're on the phone. They're working with the patients to help them get on payment plans, work with their insurance, all of those things. It's really just the very old accounts that are sitting in over, maybe even 10 years ago.
So, and your anticipated timeline to decide, okay, we're done, let's bring in the collection agency?
Probably in the third quarter of next year, we'll have a better idea of what those accounts will be to push to the collection agency.
Okay. Appreciate everyone who came out and provided your information to us, but I also would greatly appreciate if you made some phone calls to the other senators and asking to push for this money. I mean, today you asked us, but really, like the speaker said, it's going to take 8 of us. The budget chair, yeah, especially, Lillian. So please. I'd like to ask you to do that, please. Because we're up here fighting for you. We're only 4 right now. Okay? So thank you, Madam Speaker.
Thank you, Senator Teichgui. Senator Blas.
Thank you very much, Madam Speaker. Thank you for being here. I'm going to reiterate, okay? First off, I appreciate the presentation you made. I know the struggles. I know your struggles. Doc, I have to agree with you. You're a public hospital. Senator Teichgui said, you're going to be in the red all the time. All right? No matter where you move the hospital to. Okay? And unless Congress changes laws and stuff that affects healthcare in Guam, that's our reality. We recognize that. Let me just a little bit of first off, what's your total operations cost annually?
Almost 200 million.
Of that $200 million, how much is that? Was that personnel?
Personnel is about 132.
132. And your vendors?
For supplies, we have about 22 million budgeted for supplies.
Okay. What's the other 50 million? 50 mil?
Utilities is another 4 to 5 million. Contractual, because we have to pay our doctors, and before we're paying traveling nurses. We have a lot of contractual agreements for like maintenance. One of our biggest ones is to maintain all the radiology equipment that we have. We have to have the professionals come in every month to maintain those equipment. Laundry services, trash services. I could go on and on.
Okay. And was the total amount that you received from the ARP, from the governor, ARP, just 20 million, or did you get money elsewhere?
That was what was committed by the governor, 20 million at the time that you appropriated the 30 million for the vendors. 20 million was what
20
was
million.
committed.
Wow. And how much do you need? 35? Okay. The reason why I'm asking is because the 35 million that you've said it, you stated that you need now. 20 million was for ops and 15 million was for vendors. Have you made an assessment of this 35 for the operations for vendors? If you were given that opportunity, how much of this would have been qualified for ARP funding?
Can you repeat that?
You have $20 million for operations that you need, okay? And the 15 that you need for vendors. How much of this, knowing, what the rules are for ARP spending, how much of this would be qualified for ARP spending to be utilized? Not with the $20 million you got right now, but for X amount that you...
I am honestly not sure, but I think with the ARPA, we have some kind of dates that we need to look at to see whether...
You need to encumber it by December 31st of this year and spend it by December 31st of 2026. You need $35 million tomorrow.
Today.
Or to yesterday. Okay? So I don't think there's going to be any difficulty being able to encumber it, much less spend it in the time frame. My question is whether or not any of these expenditures, any of these amounts, would they be qualified? You wouldn't know? Okay.
We would have to research and verify.
I think it's a great thing to be able to research because, you know what, as we're trying to struggle here to be able to find monies for you, okay? There's a pot of monies that's sitting there that could have been utilized, that could be utilized. There's no doubting it. All right? It's just a matter of being able to convince that this is a priority. You're sitting here, we're sitting here, identifying this as a priority. I don't think there's more of any, I've always, my litmus test for what a priority is in government, okay, is whether or not you're able to take any government employee from any other agency, stick them into your department, and let them work for 1 hour. Okay? I can take another, can I take another government employee from another government agency or from another profession and be able to stick them into the emergency room and for them to be able to function properly for an hour, much less a minute? No. But I can take a doctor, a nurse, or any person in here and be able to stick you in some other government agency and you can run it for a week. That's where I identify the priorities. And as we're sitting here, there are millions of dollars that have been set aside for those other things other than the priorities that we have here. So I don't know why we're fighting. Okay? Really, this shouldn't happen. Again, let me go back to that GITA contract. You're going to contract a consultant to come in and tell you what your problems are now so you don't take it into the next facility? What? The problems exist now in the facility that is responsible for health care now. if you fix the problem today, now, it's a problem that will not exist when the new facility exists. So what are we doing? And much more, why didn't they tell you that they were doing this? Okay. So that's where, you know, I sit here, I'm like, why are we having this argument? Why are you even struggling? Okay, as an entity that is a priority, that should be a priority in this government. I would rather that this conversation is, we need authority to be able to spend this money or to be able to get this now. We have the money, but we don't have the authority or the ability to do that. I prefer that conversation than the conversation I'm having right now. You know, and I was looking at all your projects and everything is great. But you know, I knew a lot of this is catch-up. Okay? A lot of people may look at this and say, oh my God, look at that wish list. Oh, look at what they're getting, look at what they're buying. This is what is necessary to run your your hospital. My concern, though, then is once you're able to get this, how are we going to maintain it? Because it's one thing to take it out of the box, it's another thing to make sure you have enough money to be able to pay for the maintenance for it next year. You know, and, you know, just going to bring this up on a lighter note. You know the aircon units that you put into the labor and delivery? Okay, the split units, right? We have people trained enough to be able to come in there monthly to be able to clean the filters. Yeah.
Yes, sir.
Yeah.
You're trained.
Because there was another entity in this government that said they needed additional money so that they can train people to be able to take down the filters to be able to clean it. Okay? Again, I appreciate the presentation. I appreciate what you do, okay? I know what you're doing. I think there's one of the very few in this legislature that continues to understand what you're doing and the struggles you're going through. Okay? It's not your fault. But I think that what happens, as was stated earlier, when we're sitting up here, we're getting the mixed messages. When I have an agency that says initially that I need $74 million, can you please give me $74 million additional? And then I look at a budget that's actually less, much less than what you're asking for. And I'm saying, okay, where's the wiggle room here? And then I'm told, oh, well, you prioritize it. If I prioritize it, like, you know, Senator Brown had stated, be very simple. You're just going to make sure that some agencies don't exist. But is that the priority of the front? This should be the priority. Like I said, okay, you can go in different entities in different positions throughout the government and be able to run it for a week. I wouldn't trust them to be able to be in your emergency room for a minute. That's how I measure your priority. Okay? So, can you go back and look at of this $35 million? How much of this could be actually would be qualified based on guidance for ARP funding? That would really help. Okay? Thank you very much. Thank you very much, Manager.
This is Masi. Senator Blas. I want to conclude the hearing, however. I did receive some questions. Is it correct that on-call doctors are paid $4,800 for the 24-hour period?
Madam Chairwoman, as far as I'm aware, there's no doctor that's paid that amount of money. but I can research into it and look into it. But as far as I'm aware, that is not the case.
Okay, all right. And if a person's a medical director on a salary at GMH as a medical director, do they also get paid to be on call extra? And do they get paid for also being a hospitalist, I guess, in addition to being a medical director?
I think you're trying to ask if a person is function as a particular specialist and they're also a medical director. Are they being paid for their job as medical director plus their job as a specialist? Is that my understanding?
I think so. Mm-hmm.
Can I use myself as an example? Is
Sure.
that okay? I'm a board certified brain and spine surgeon.
Okay.
I provide brain and spine care
Brain
for the
and
people
spine.
of Guam. When I'm on call for the hospital in a 24-hour period, I get paid $1,000. Recently, I was made the acting associate medical director of medical services. I have a salary that I get paid for doing that job. That is a separate job from my on-call duties. I believe that would answer your question. Is that what you're trying to ask?
I guess so. Yeah, okay. And you have medical directors for OR, labor and delivery, ICU, special care. Now, there's others. There's medical services, you said. All right, just checking. Maybe you can just give me a write-up on that. So explain to the public how that works. All right. And I just want to conclude by thanking you for all your work. It's not a pat on the back. I just want to say that very publicly to thank you for all your work. And I know that the conditions are hard. And to be on the same page, I think we're only going to be successful if we are on the same page. So that's why information is very important. That's why I've had so many multiple oversight hearings, informational briefings, different hearings so that GMH can come and tell their story in detail and we can get these stories straight. In FY24, fiscal year 24, we appropriated $30 million for GMH. I think that was a little bit more than their prior year and a little bit more than their request. BBMR, who, manages the budget for the entire government, they seemed happy. It was very shortly after that budget passed when we came back because based on different things, because you had projected to bring in revenues that year, you were, that would have been enough. But very soon after that, maybe within the month, we were back for the $30 million owed to vendors. Part of that was because of the system being shut down, different things. So that was a total of $60 million, as the CEO said, that went to GMH in FY24. The governor's budget request for FY25 was $31.8 million. That's 1.8 over the 30 we originally appropriated in FY24, and a lot less than the 60 million if you add on the 30 million for vendors, right? Your request, GMH's budget request, came in separately at 74, which is like 44 million more than the 30 million, right? And I thought you did GMH did an excellent presentation as to the need and what happens if you don't get that money. I thought that was a very good presentation. I believed it. In the budget negotiations between OFB and BBMR, or whoever negotiates on behalf of BBMR, DOA, they came out with a bill that only gave GMH 37.7 million. Again, that's compared to the 30 million in FY24 and the 30 million in vendors, 60 million. The bill was 37.7 million. That's a sub-bill. So it's a little bit higher than the governor's request of 31.8, the original bill. 37.7 was a little higher, but not at all near the $74 million request. On day one of the budget session, we came in, BBMR and DOA passed out a letter saying they want the legislature to increase the revenue projections in the bill by $43 million for FY25, that we could increase what we are going to receive in FY25 by $43 million, and thus we should and they had a list where we should allocate that 43 additional million. None of that was for GMH. That additional 43 million that they advocated for was not for GMH at all. So I did ask them then and there, why does the bill look like this after GMH's request was for 74 million? Why does this letter saying we can afford to appropriate more, $43 million more, not include GMH either? And we're talking to BBMR, and DOA was not represented that day, is that right? Yeah, they were not. So just BBMR. And they said, and because I asked them, they were also on the fiscal review committee for GMH. So after we passed that bill to pay 30 million in vendors for FY24, the governor by executive order set up this executive review committee, fiscal review committee for GMH so that we would not have those problems going forward. It's supposed to be giving advice on what to fix, including, you know, the billings, the Medicare rates, everything. Anyways, they did not say we're wrong when I asked why was GMH not included. They did not advocate to include GMH anymore. They just didn't. Those are the facts that you need to know, and you need to know, and I think the trustees need to know. And the trustees need to really follow these things close enough to know where you need to put some time in, maybe, you know, I'm gonna say that nicely, because I cannot do it alone, you know. We can't just say, GMH asked for this money, we need to give it to them, when everybody else is saying they don't really need it. That's kind of the impression that they gave. They don't believe that GMH really needed it. So, as Senator Blas said, yeah, we're forced in the budget process to fund more. We have to cut other agencies. It's like a cannibal system, you know. I got lots of criticism for cutting one of the other very necessary agencies, but we have to decide what can be funded with ARP, what can't. That's another very good question. How desperate are we? You know, do we use ARP funds or not for this, right? And can it be used? I think you were able to use ARP funds for a lot of purposes, right? And so maybe those still apply. But anyways, so I am hoping that in the supplemental budget bill that comes up, we are going to get some additional funds for GMH. But again, right now, the number that's being used is 20 million, and that I thought was, I was very optimistic because the governor agreed 20, and maybe we're gonna be successful. And the OFB chair seems to be open to putting some money to GMH, but now, yeah, I can't guarantee that. So our work is still cut out for us. But I'm very concerned to hear that even that will not cover the 15. That's still very concerning to me. So we just have to look for other strategies, I guess. So, but I will continue to look for those. Please help me. I mean, if Gita is going to do work for GMH, I hope Gita can also look for grants, right? For GMH in whatever areas that they can. They are able to get grants for other projects like UOG expansion for their healthcare building, right? I think some of the EDA money is going to go to GCC. They said they're going to expand their healthcare building. I'm not sure if it's available for GMH, but we are an underserved community, right? You were able successfully to make sure that we were classified that way, so I thought that was for grant funding, right? So anyways, we'll just all have to continue to work, and I'm very grateful for all the work that all of you have put in so far, and I'm really looking forward to those physical improvements at GMH. We're putting a lot of money investing in just for supposedly a 5-year period, but necessary, as everyone has said. So si Zeus Masi again to all of you. And with that, we're going to adjourn this hearing. It is 6:20. Thank you again for all your time. Si Zeus Masi.
Thank you, too, Speaker. Thank you.